It is my pleasure to invite Ms. Heather Machin, who's again going to be talking about status of iBanking globally, and she represents the Global Alliance of the iBank Associations, the GAIBA.
So just So thank you very much, Namrata and the iBank Association of India for inviting me to present today. I'm really honoured, even though it is close to midnight. You've got the manic Heather as opposed to the composed Heather. So I hope you'll have a bit of fun with this. I did know that every other speaker was going to talk about what's happening in every other country and show you different stats and different changes in the donor referral system. So I'm intentionally not going to do that. I'm going to take a different angle and talk about things generally, and then perhaps try and put a positive spin on this and perhaps how we can adapt ourselves. So anyhow, here we are, 2020. I was looking forward to it. This was the year of the Global Blindness 2020 campaign. We had so many celebrations, but not to be. So the 2020 that we actually got is a little different, but it's certainly a shared experience. And this is the only time possibly in our lives where we will actually have a shared experience, be it alone, it's still a shared experience. So where does that leave us as iBankers? Well, first of all, let's have a look at the need and demand matrix. Ideally, we should have several principles working simultaneously. So for example, access to tissue, testing, access to operating theatres, a plentiful supply of workforce, nurses, surgeons, for example, and of course, all of these things working at the same rate as the size of the population. That's ideally how it should be. And in several parts of the world, demand and sometimes need have been met. However, now with COVID-19, that might not be the place. In fact, demand probably won't be met all of the time, and needs certainly won't be met all of the time. These fluctuations will change not based on nations, but based on specific locations, as Dr. Pollock just said. It's changing all across Australia. It's changing across every single country. So if you're experiencing that, you're not alone. Your wait times will go up, the delays will extend, and this is the new reality. It will be for some time. The interesting thing is every single person that's communicated with me about COVID in our field over the last couple of months, we have a shared experience. We all have issues with too many donors, not enough donors, no one in the hospitals doing the consents, no staff available, resources going to PPE, no flights. The list goes on, and this is a shared experience, and we're not going to get out of this on our own. We're not even going to get out of this as iBankers. We have to be part of the health system and recognize how uniquely and integrated we are into the healthcare system. We go one, we go all. So we have to work together, not just with iBankers and ophthalmologists, we have to work outside of that as well. So long term, what will the world look like? It's so difficult to know. I tried to be really prepared for this meeting and give you some really proper stats, but the thing is they change every day and every month. The global economy might retract. 5.2% seems to be the figure I'm finding today, although it might go to 7.2 in advanced nations. But even poverty rates, right now there's 734 million people who are below the poverty line if you consider the poverty at $1.90. There's estimates anywhere from 70 million to 100 million extra people added to the poverty line. I want you to think about what that reality will look like. Will we have people shifting from private health to public health? Will we have people able to afford the surgeries that we provide and the corneal tissue that we provide? Because not every country is as lucky as mine, where our government and our health insurance companies pay for their tissue. We have to consider this. It's absolutely soul destroying to think for some sectors, hopefully not ours, but certainly some other health sectors, that the work that we've done in the last 10 years, maybe even 30 years, has been completely wiped away. In fact, I read a stat today that this is the first time since 1988 that that poverty line has actually gone down. These are different times. It's quite overwhelming, and I wonder what it is I'm going to take on. So we have to find some way of being positive and using this time as constructively as we can. So we need to find a way to adapt, to help ourselves, to help those around us, but also thrive. We need to be valid today, but also find validity in the future. We need to adapt our health services. We also need to adapt our iBanks. So for example, at the beginning of the first wave in the USA, iBanks like Miracles Inside in the USA, they were putting together 3D face masks for their local health service. That's adapting, that's helping. Nurses in the eye bank in Sydney, they were going into the front line. That's adapting, that's helping. Those eye banks that were moving staff into other areas, they didn't have to furlough staff. These staff were still being employed. This is a fantastic way of moving staff out to then move them back in when we need them. Think constructively about how we can be creative with our current and then our future steps. Consider also the humanitarian aspects. Now, the Global Alliance of Eye Bank Associations has been promoting for quite some time the need to work together as a community. If we don't work together, we're not going to get anywhere. But the funny thing is with COVID-19, this is the catalyst to actually bring us together as a community. There is nothing stronger. Take this meeting, for instance. Here we all are. There's people all over the world with this meeting. It's bringing us together. We need to harness that. It's quite overwhelming. So also have some fun with it. My photos here are some fun that we have in Australia with our meetings. I encourage you to make the most of this opportunity to communicate with each other and have some fun with it. Also take the time to stop. Never again are we going to have the opportunity to do a hard stop and a real think about what it is that we want our sector to look like and what kind of world it is that we want to live in. Use this constructively and critically to examine your individual organizations, your professional associations, and also how you work as a nation or a region or a member of the global community. Consider, for example, where you sit with some of the seminal frameworks in this field, the Global Alliance Barcelona Principles for one, and also the Sustainable Development Goals. You may also have roadmaps that you're looking to work towards. Have a look at what your current plan is. And if you're not working towards those seminal recommendations, now is an opportune time to do it. This is a golden opportunity to review, consider, reform, and readapt and revamp our eye care sector and our eye banking sector for whatever this new reality is going to be. So get involved. Thank you so much.
Thank you.